Kisii County is currently among the top 10 in HIV prevalence. Among the men of the ages 20 to 39 contribute 76% of the total number of new infections for those ages of 15 and above. Male involvement along the continuum of HIV healthcare services has been promoted as a critical intervention in Kenya. We realize that lack of men involvement represents one of the reasons for dropout and low retention of women along the cascade of care. Through Global Fund and supported by Kenya Red Cross as the principal recipient, DMVV is implementing community-led interventions targeting men in informal workplaces such as the jua kali, the men in tea-growing areas, brick makers, matatu touts, and the boda riders, reaching them with health promotion education, STI screening and treatment, TB screening, HIV testing, and access to PrEP, condoms, GBV, referral pathways, and referral services. My name is Gianya Pola, currently working for Daraja Mbili Vision Volunteers as a program officer supporting Nyaribari Chache Sub-County. For this event today, we are having event for the men, targeting the men with reproductive health services. So we are targeting men because of their poor health-seeking behavior. This is mainly because of lack of information. We have also retrogressive cultural beliefs and practices. This is such as where men believe that it is a show of weakness when they actually go to seek healthcare services. Often these men will come at the very later stages of their illness, making it very hard for them to be properly attended to medically. So in this event today, we have also been privileged to be able to partner with various stakeholders. Amongst them are the Ministry of Health, where we are partnering with the Ministry of Health to be able to provide for us doctors, nurses, and even the HTS service providers who are providing various services today. We also have representation from the national government, which is led by the CEO of Kenya Innovation Agency, Dr. Tony Omwansa. We also have representation from the county government, spearheaded by our area MCA, Steve Arika, amongst other MCAs who have been able to come for this event to not only support the men, but also to support the adolescents and young women. We have been able to reach out to other agencies who have been able to also come in very visibly to be able to provide us with the right messaging and even provide various commodities such as the condoms and even sanitary pads for the girls. We understand that getting to these men, especially from these various workplaces which are very involving, is very hard, and that's why it was key to involve all sectors and various stakeholders to enable us sit together and see how are we able to attract these men from their various economic generating activities to be able to come for this event. So through that, we were able to come up with various activities such as football, which we are using as a medium of socially bringing the target group together. We are also having food eating event where we were sponsored with bread and sodas just to be able to liven up the event. We also had a tug of war for various cohorts in the community, for the women, for the men, we even have a group of alcoholics who actively participated for this event. We have not left the women behind, because for such a big event, you realize that the women will still come in really asking what is going on in this particular event. So we did not leave them behind, and we also reached out to other stakeholders such as the women MCAs to be able to come and talk to the girls and the MOH to provide services for these AGYWs. The AGYWs, we did not want to leave them behind because we realized that they are also a very key component in this event. By them coming, they are also attracting more of the men to be able to come for this event. So they were not left behind. We had cooperation from our women area MCAs who came together to be able to give health talks to the girls. Among other stakeholders at the Ministry of Health, who are also able to give healthcare education on sexual reproductive health care. We were able to do HTS screening, HIV testing. We were also able to do TB screening and also provide healthcare services to the participants. By bringing those services closer, we are hoping that more people will be able to know their HIV status. For those who know their HIV status, we are working on ensuring that they are adhering to their drugs. And for those who are adhering to their drugs, we're also ensuring that they are virally suppressed. This all to be able to achieve the 95-95-95 HIV cascade.
At the end of today, there is something new you will learn about HIV. So, njia ambazo mtu anaweza kuambukizwa virusi za HIV kutoka kwa mtu mmoja kwenda kwa mwingine, njia zipi? Inawezekana hata ushiriki ngono na mtu na usimwambukize. In fact, that's what we are doing. So, in other words, if you have a friend who is HIV positive na amekataa dawa, please encourage that person. Assure confidentiality, mwambie ende umeze dawa. Ukimeza hii dawa, virusi zitapungua, hata ukipimwa hazitaonekana. Hata ukipimwa wakati umesuppress vizuri inakupatia negative result. But with advanced machine bado itaonyesha uko positive. Where we are encouraging that everybody mwenye ako HIV positive ameze dawa vizuri mpaka suppress. Hawa ambao wamesuppress hata ukifanya ngono huko nje na wenye hawajaambukiza hawataweza kuambukiza. That is the same way we are defeating COVID.
Mumejisahau katika society, you can no longer walk with your heads high. And it's very unfortunate. And that's why we are here to talk about the boy-child empowerment. Therefore, musidharau. This is very, very important.
Thanks very much. My name is Dr. Tony Mwanza. Yes. And I'm serving as the Kenya National Innovation Agency CEO.
Yes. First of all, let's look at innovation as one way of creating jobs and employment, which then makes people less likely to be caught up in certain challenges as sexually transmitted diseases. So that's one dimension for you. The second dimension for you is innovating in the way we deliver the message that you are actually delivering in order to get people to participate. When you created it fun, so that then they can come, you innovated.
Tuambie, unaonaje wakati mnaletewa services closer na wakati mnaenda facility, ni gani inakuwa rahisi?
When they are closer to us, inakuwa rahisi kushinda vile ziko mbali.
Kazi yetu kupata time ya kutoka nje, kupata services zingine ni ngumu sana.
Okay.
Yeah. So kama hiyo medical wise, so unapata uje si watu wetu tumeandikwa ati uko na off.
Yeah.
Na kuna sometimes unapata kazi from Sunday to Sunday.
Okay.
Na kutoka ni asubuhi jioni, so hata una time ya vitu zingine mingi.
Okay. Yeah. So tukiweza leta, so ungependelea services kuja closer na mnaweza pata hata kama mna off.
Yeah. By the way, in fact hata ninge prefer at least kama mnaweza mkuje mvisit sites.
After reaching out to the youths through where they work in their workplaces, we have a transition form in our static center, that is the Youth Wellness Center, where we have different services that are provided. The center acts as a retention point where we can observe different service-seeking behaviors amongst the youths. This one helps us to pick a trend so that we know what kind of services we can take out and what kind of services we can have at the static center.
My name is Kisii County. I'm a nursing officer in charge in Kisii Youth Wellness Center, which is under the umbrella of Daraja Mbili Vision Volunteers. Kisii Youth Wellness Center started in November 2022 with the aim of talking to youths and offering quality services, youth-friendly services to the youths within the age cohort of 10 to 24 years. However, we still serve the youths above 25 years old. Kisii Youth Wellness Center has professionals who offer quality services to include clinical officer. We have an HTS counselor, psychosocial counselor. We have a receptionist, a field officer, a nurse, and data clerks. The youth walk in here and they are attracted with the games that are offered here. During the time they are interacting with the games, they are given services and they are given education. We also work with the peer educators who are the age cohort of the youths, who welcome the youths into the facility, give them education, and also do appropriate referrals to them, depending on the services that the youths need. At the youth center, we also have a resource area where they're able to interact with computers, they're able to learn. We have IC materials there that they're like flyers and brochures, which have different information in regards to their reproductive health and also general health. We offer services like HIV testing and counseling. We do cervical cancer screening. We do STI screening and treatment. We offer health education. We give contraception, general treatment, and also psychosocial support. Besides that, we also talk more about issues to do with gender-based violence and give appropriate information to the youth.
This is Kisii Youth Wellness Center. The place here, my youth have fun. It's a nice place. I've been here for a mentorship, gender-based violence. Nimejua kucheza pool pia hapa. There is a lot of fun. There is free counseling, testing HIV. Kuna interact and many more. Welcome. Feel free.
Hi guys, I'm Mbili. I'm 17 years old. As for me, I'm a dancer and I've met some of the dancers here. We're enjoying and having a lot of fun.
My name is Carlos, Carlos, Yes, I'm a beneficiary of Kisii Wellness Center. Hilo place mawitu wanakuja kwa fun. I personally undergo testing ya HIV. Pia kuna manasi wanafanya counseling and kuna vitu kama free wifi and other things kama games, chess, pool.